Hey everyone, my name is Adrian Field. I'm an expat entrepreneur currently living in Lisbon. So the subject of today's video is actually really important if you are considering moving to Portugal. Today we're going to talk about the health system in Portugal, how things work with the national system, private insurance, etc. Let's just get right into it. So first thing is, you may know, depending on where you are in this process, that if you are planning to move to Portugal and applying for a residency visa, one of the requirements of that residency visa, regardless of what type, is that you have already private insurance. Now, for example, what I did as part of my application is I got travel insurance from AXA, and I basically did it that covered me for 6 months, which is the maximum coverage period of this type of travel insurance. And it was really cheap. I think I paid something like maybe 160 euros or something along those lines for the 6 months. And it was the minimum that was required for the application, which is like 30,000 euros. I think like repatriation if you die, basically. So that policy had all of those things covered. And basically it would have covered me from the time that I intended to arrive in Portugal after the visa was approved up until I think like 6 months later. Now, the reason that I did in that time frame was because I was only basically aware that yes, there is a health system and that you can sign up for it once you're a resident, but I didn't know how long that process would take. So let me tell you all about this, because now I feel like I'm a bit of an expert, because I also just signed up for private health insurance a few weeks ago, and thank God that I did, because just around that same time I had a little bit of a health issue come up, and I got to actually now test out what the hospitals here are like and how that private insurance works. So let's talk a bit about the public system. Now, if you are a resident here, you are entitled to join the public system, and that means that as soon as you get approved after your SCF appointment, you can then request an SNS number, SNS being the Sistema Nacional de Saúde. I think that's what it stands for. So basically the national healthcare system. And I didn't realize that you didn't need to wait until your physical card arrives in the mail to actually go and request this SNS number. Apparently you can though. So I did my research and I found that nowadays generally they prefer, most of these SNS centers, they prefer that you apply by email, especially if you're in Lisbon. I think if you're outside of Lisbon, you may be able to just go to an SNS and request in person. And again, they're going to ask for certain documents like the paper that you get from SEF, your passport, and maybe some other things. I mean, it's never 100% standard in Portugal with like what one place might ask versus somewhere else. So about a month after I got my SCF approval, I emailed and I requested my utente, which is again the SNS number. Now it's been nearly a month, I think, since I requested that, and I still have no reply. But in the automatic response I got to my email, it said that it could take up to 2 months. Now, mind you, we've just gotten out of the month of August, where like nobody in Portugal or Europe generally is working, so I understand that things might be a bit slower. Now, it's really important, again, that you do get this SNS number as soon as you can, because, for example, if you need any prescription medicine, they are basically free. And that's something that's really incredible, honestly. As an American coming to Europe and being able to access this public system, I really feel like, wow, this is something really special. And my God, we've been missing out in America, where everything is just so expensive. Healthcare, prescriptions, etc. are insane. And so it's a really great system in terms of health, in terms of medicine. Now, in terms of the healthcare, it's quite poor. Let me give you an example. So I really want to get on PrEP, which is an anti-HIV medicine, basically, that prevents the transmission of HIV. And a lot of gays are taking this all over the world these days. However, the problem here in Portugal is that it's only available on the public system, and that the wait just to get an appointment, the preliminary appointment, is usually around 6 months. And then I think sometimes they require a follow-up appointment before they will actually give you the prescription. So it's almost a year wait just to get this medicine that is really vital for a lot of people, and I find this very unfair. Now, similarly, this public system, if you actually have to use it, is quite poor in terms of like general health maintenance. When you need to go see a doctor or a specialist, the wait times are very, very long. I mean, as you might imagine, being that this is a public system, it's free, more or less free. I don't know if you have to pay anything at all or if you pay just a very negligible amount of money, but basically free. So I think this is where it's important to have private health insurance when it comes to wanting to get your checkups, when it comes to, if you're feeling sick and you need to see a specialist or whatever the case may be. So I started to do some research and I found Medis, which is a Portuguese insurer. And for about 67 euros a month, something like this, I was able to get a plan that covers me quite well. I mean, I'm able to go see a doctor, I'm able to go see a specialist, and the prices are really cheap. So for example, the copay to see a specialist is 17 euros. And included in my monthly price, I think you can see like a generalist every so often where you like have next to no copay and a lot of things, you know. So if you had to actually use the healthcare system, something like this is much better, because when you need to use a private hospital, it's much easier to get an appointment on a more quick basis than it would be for the public system. So when I had my own health issue just a few weeks back, and I was really nervous because I had never used this system before, I still again don't have even the public ID number. I was able to call up a hospital. They have a chain of hospitals here called CUF, C-U-F, and I requested to see a specialist doctor, and they were able to fit me in for an appointment the next day. And so even though, for example, with my current private insurance, there's like a 60-day wait period before they will fully cover you, I got to still pay a reduced Medis price versus what the general price would have been had I gone into that hospital and had no insurance whatsoever. So the price to see a specialist in that hospital, if I had no type of insurance, would have been 100 euros. But I just got the bill today, and the amount that I need to pay is only 37 euros. Now, again, if 2 months had elapsed since I started my insurance, it would only be 17 euros. So as you can see, it makes quite a difference. Already within the first month, I've almost paid for the value of this insurance, and I do need to go actually even see another specialist tomorrow. So, you know, when you do have like health issues that come up, it's really good to have this private insurance that supplements the public option as well. I think that together, it's really good because you can go see a private doctor, and then if they're going to prescribe you medicine, you know, they add in your public health number, and then those medicines cost next to nothing. Again, the problem that I mentioned earlier, specifically with this PrEP medicine, is that it's only available on the public system. You can't go to a private doctor and have them prescribe it to you. And so again, I just feel like this is something that is really wrong and unfair, and that hopefully like Portugal can change, because even the doctors here that I've gone to when I get my regular testing have said that it's a very bad system here when it comes to PrEP. So anyway, that's my gripe about that particularly. But again, I think that it's really great that you can have a good private insurance for, you know, less than 70 euros here if you're young and in good health and don't have like a ton of prior, you know, conditions. Versus, you know, in America, this is something that would cost a lot more, you know, hundreds of dollars a month to just have a basic health insurance plan. And it's almost actually more or less the same price that I was paying even in Indonesia to have private insurance. So, you know, this is something that is really good here in Portugal. My experience with seeing the specialist at the hospital was, you know, pleasant. She spoke decent enough English that we were able to, you know, have a conversation about the kinds of issues and things that I had come in with. So again, in that regard, I feel like I got, you know, good quality healthcare. And, you know, I'm quite relieved to know that if I stay in Europe for a long time, you know, you're kind of taken care of. And again, I just think that that's something that is really good versus how things are in America, where we don't have a good healthcare system and how everything is overpriced. The only thing that you need actually in order to get a private healthcare plan here in Portugal is your NIF. So basically, even before your SEF appointment, before you're officially a resident, you can still sign up for a private healthcare plan, even just with your NIF. So again, this is something that I would do if I had known what I know now. I would have done this as soon as I arrived in Portugal, even though I'm actually still covered under my travel insurance up to actually at the end of this month. So, but with that, you know, it's more like an emergency situation. You're not entitled to just see, you know, a generalist, you know, for a checkup. But again, I think, for example, with the issue that I had been facing recently, I believe that I can still request reimbursement. Anyway, guys, that's actually it for this video. Just a short public service announcement of what I've learned in the past month or so since getting private health insurance, since signing up for the public health option, and also just being not in the best of health the last few weeks and actually needing to use the healthcare service here in Portugal. So thank you guys for watching, and until the next time, take care, and I'll see you later.